directors in Seattle, of Seattle study clubs, and were totally thrilled and praising the periolays and the LANAP protocol and the results that they were seeing.
Next patient is Kathy. She came in with a loose tooth, and she was, it was kind of interesting because she's a musician, and one day she said, I cannot really play my instrument because I'm really worried about this front tooth, because front tooth was extremely loose. And she was recommended for extraction of possibly 2 teeth or 1 tooth in the front because of this loose tooth. She was a little bit hesitant with going with an implant because the front area in the lower jaw is extremely difficult to do implant therapy because there's no implant that is going to fit here precisely because tooth is so small. So we said, you know what, why don't we try this laser therapy again? And guess what? When I saw her for the follow-up, the bone was growing back. And then now, instead of talking about having 1 or 2 implant, which is extremely invasive and also costly, we totally saved these teeth.
Bone growing back around teeth? Are you kidding me? Bone growing back around implants? Are you kidding me? Much less getting rid of the infection. It really happens. It's shocking. It's incredible. I can't believe it.
So the patient was referred to us specifically seeking LAPIP therapy. The patient was an engineer of all things, so very detail-oriented, knew exactly what he wanted and had already done the research about the laser. So he looked us up to seek out LAPIP therapy. The patient presented with localized gingival inflammation and exudate on probing, and some tenderness on probing as well, and radiographic bone loss around that area about halfway down the implant. The implant was placed 4 to 5 years ago, and the patient didn't want to lose the implant or go through another surgery to have the implant removed. The implant was a cement retained restoration, so we opted to keep the implant in place during LAPIP therapy. And as you'll see in the radiographs, we have increased radiopacity around that implant and decreased gingival inflammation, and we also got some tissue shrinkage around that area. So the tissue is tightening up and just presented as healthy, firm coral pink tissue around the implant and including the other tissue in the lower right quadrant. At this point, we have remarkable bony regeneration around that implant, and the prognosis has improved from questionable to good long-term prognosis.
I have had a patient that was referred to me 3 times for periodontal treatment. Each time he came for the exam and never followed through with treatment. It wasn't till LANAP that he accepted treatment.
The protocol itself, there's minimal discomfort, and that thrills them, and what thrills them even more is when you show them down the road when you've regenerated bone for them.
The most important part of purchasing the periolays is the fact that the training is included. When you have an opportunity to learn things hands-on, it's a phenomenal experience. It's not like you're going back home and you're trying to figure it out for yourself. This is one of the few programs that I've been to where you actually go back and your laser is there waiting for you, and you have the opportunity to use the periolays exactly the way you were trained to use it.
Be able to preserve those teeth for the long term has just been incredible, and it's probably one of the most rewarding things I see throughout my day.
I wouldn't hesitate for a second to offer this to my patients. I think it is as or more effective than any other form of periodontal therapy that I've rendered in the past. I love it. I absolutely love it.